For as long as we can remember, the idea of reversing aging, that was pure science fiction, right? Something out of a movie. Well, what if I told you that the very first human trial to do exactly that is happening, like right now? This isn't just some theory in a lab anymore. This is real-world science with real patients, and honestly, it could change everything we think we know about getting older.
And look, this quote right here from Harvard's David Sinclair, he's one of the co-founders of the company running this thing, this is why everyone is talking. He's not saying, oh, it's a small improvement. No, he's talking about a near total reset for ourselves. I mean, that is a massive claim, and it's exactly that kind of bold statement that's pushed this whole field right into the spotlight.
So, okay, is this it? Have we really finally found the fountain of youth? That is the big question, and that's exactly what we're going to tackle in this explainer. Let's dig in and separate the incredible hype from the actual science.
All right, so how did we even get to this point? I mean, this didn't just happen overnight. It really boils down to one single historic decision that took this whole idea from a possibility in a petri dish to a reality in a clinic.
January 28, 2026. This is the date. This is when the U.S. Food and Drug Administration, the FDA, did something pretty much unprecedented. They gave the green light. They approved the first ever human trial for something called partial epigenetic reprogramming. And believe me, this wasn't just another press release. This was like the official starting gun for a whole new era in medicine.
And the company right at the center of all this is Life Biosciences. Their gene therapy is called ER-100, and it's what this whole trial is about. Really, they're trying to answer one massive question. Can we actually and safely turn back the clock inside our own cells? Okay, so how on earth is this supposed to work? I mean, cellular time travel? It sounds complicated, and yeah, the deep science is deep. But the core idea is actually brilliantly simple. It's all about the instructions our cells are getting.
So here's a great way to think about it. Your DNA, that's like the hardware in your computer. It's fixed, right? It doesn't really change. But the software that runs on that hardware, that's your epigenome. And just like old software, as we age, it gets cluttered, buggy, and slow. What's so cool about this therapy is that it doesn't try to change the hardware. No, it's basically a software reboot, trying to restore it to the clean, efficient state it was in when we were younger.
And this didn't just pop up out of thin air. It's built on decades of incredible science. It all really kicked off back in 2012 when Dr. Shinya Yamanaka won the Nobel Prize for figuring out how to completely reset adult cells back to stem cells. Fast forward to 2020, and a huge study in Nature showed that a modified, safer version of this could actually restore vision in old mice. And that breakthrough is what directly paved the way for this human trial. So here's the really clever part, how they made it safer. The original recipe used 4 ingredients, these Yamanaka factors. The problem? One of them, a gene called Semok, is a known troublemaker linked to cancer. Not good. So what did they do? They just took it out. This trial only uses the other 3 safer factors. The goal is simple: get the rejuvenation, but without the terrifying risk of creating tumors. It's all about finding that perfect balance. Which, of course, brings up a super obvious question. If you have this technology that could, in theory, rejuvenate any part of the body, why on earth would you start with the eye? Why not go for the whole shebang right away? Well, the answer really shows you how careful and strategic the scientists have to be here. This isn't about making a big, flashy headline. It's about taking the smartest and, most importantly, the safest possible first step. See, trying to treat the whole body systemically right now, way too risky. You just don't know what unpredictable things could happen. But the eye, well, the eye is like its own little self-contained bubble. It's easy to get to, it's easy to watch what's happening, and whatever you put in there pretty much stays in there. That makes it the absolute perfect, low-risk laboratory to test a totally radical new idea like this.
And they're not just testing this on anyone. They're specifically targeting 2 conditions that cause age-related vision loss, glaucoma and another one called NAION, which is kind of like a stroke in the eye. In both diseases, the critical nerve cells that connect the eye to the brain are dying off. So the big hope here is, can this therapy bring those cells back to life and maybe, just maybe, restore some of that lost sight?
Okay, and this is where we have to talk about the reality of a phase 1 clinical trial. Because while the internet is screaming age reversal, inside the actual clinic, the definition of success is, let's just say, a lot more sober and way less dramatic.
Honestly, if you remember one thing from this whole explainer, make it this. A phase 1 trial is about one thing and one thing only: safety. That's it, period. The scientists are looking for problems, any bad side effects, any inflammation. Before they can even think about proving that it works, they have to prove that it's safe and doesn't hurt people.
So here are the nitty-gritty details of the trial. But I want you to look at that last row, the mechanism part. This is so cool. The therapy actually has an on switch that's activated by a common antibiotic, doxycycline. So the patients literally take a pill to turn the gene therapy on. This gives doctors an incredible amount of control, and it's a huge safety feature just built right into the system.
In this quote just hits the nail on the head. It perfectly sums up the two different worlds this trial is living in, right? The internet and all of us get excited about rejuvenation, but the regulators, the FDA, they care about words like dose, tolerability, and adverse events. The real magic, the real progress, happens right where those two worlds meet.
So, let's circle back. If this trial isn't about finding a magic bullet for aging right now, and if the main goal is really just about safety, then why is everyone saying this is such a monumental step forward for medicine? What's the big deal?
It's a big deal, because this could be the birth of an entirely new class of medicine. Think about it. We're moving past just treating symptoms or trying to replace parts that are broken. For the very first time in a human trial, we are testing the idea that we can simply reprogram ourselves to be healthy again. That's not just an improvement, it's a complete paradigm shift in how we think about treating disease.
And the ripple effects are already happening, way outside the lab. You've got glaucoma patients going to their doctors asking, hey, can I get in on this? You have other biotech companies wondering if they need to speed up their own research. Heck, you've even got health insurance companies starting to model out what something like this would cost. This trial has forced everyone to start talking about the future of medicine, not in 10 years, but today.
So as we all wait and watch the safety data from this trial come in, we're left with this one big thought. No, this isn't the finish line for age reversal, not even close. But with the FDA giving the go-ahead, and with the very first patients getting this therapy, you have to wonder, is this the official start of the race? Thanks so much for joining me for this explainer.